For those living with severe obesity who've tried just about everything to lose weight and failed, it can be a transformative procedure. But bariatric, also known as weight loss surgery, could come with a heavier burden for some patients. I'm Tisha Powell.
And I'm Lee Zurich. Bariatric surgery not only helps people shed pounds, it can also reduce their chances of type 2 diabetes, heart disease, and high blood pressure. But some research suggests the surgery also comes with a little-known risk called transfer addiction.
This happens when someone transfers their addiction to food into another compulsive behavior like drinking alcohol, gambling, or drugs. Reporter Kristen Crowley uncovers why some in the medical field are hesitant to talk about this risk and hears from those wanting to shine a light on this dangerous complication.
I was probably 18. She's probably like 21, 22 in that picture.
Sisters often share a special bond.
She was funny, she was charismatic.
That was certainly true for Amanda and Carrie, who not only considered themselves best friends, they also lived next door to each other and traveled the world together.
Hawaii for her 40th birthday. We went to like Key West in Mexico. We did a med cruise out of Rome to like four Greek Isle stops.
But for Amanda, the most impactful journey was one she never expected. Carrie's weight loss journey after bariatric surgery.
I saw how happy she was and how she was coming out of her shell. She was being more social.
So the surgery seemed successful.
Yeah, totally successful.
Did exactly what it was intended to do.
Yeah.
But it came with an unintended consequence.
At some point, after about 2 years, I started noticing her drinking more, or the drinking, her just being 2 drinks and so incredibly drunk.
Your sister's drinking habits before the surgery.
Mm-hmm.
How often was she consuming alcohol?
6 times or less a year.
She was not an alcoholic.
No.
After surgery, it was a different story. Amanda says Carrie drank regularly. She believes it was all related to a little-known potential side effect called transfer addiction. The Obesity Action Coalition says transfer addiction happens when patients with compulsive eating habits swap food for other things like alcohol, drugs, gambling, sex, even shopping. It says studies show as many as 30% of bariatric surgery patients experience it.
Did doctors ever tell your sister or warn her about transfer addiction?
To my knowledge, her doctors did not tell her this was a possibility.
And that's because they don't have to. It's not a requirement for accredited bariatric surgery programs. Those standards are set by the Metabolic and Bariatric Surgery Accreditation and Quality Improvement Program, also known as MBS-AQIP. Dr. Ann Rogers is president of the American Society for Metabolic and Bariatric Surgery, which works with MBS-AQIP.
What do you think about that, about some calls to make this part of the education before surgery?
These programs, for a lot of patients, take a long time to get through, and you're hit with a fire hose of information, and it's hard to remember every single thing.
On top of that, Dr. Rogers says one reason transfer addiction isn't mandatory to teach is there's not enough research to show it even exists.
It's very hard to study in humans. We don't even know if there's such a thing as food addiction per se. So while you can go without cigarettes or alcohol, you can't go without food. So we can't study what it's like to have people quit eating cold turkey. So that just makes it impossible to study it as a form of addiction.
But the effects of alcohol on people post-weight loss surgery are well known.
You very quickly can get intoxicated as well as dehydrated and malnourished. So we do say, after surgery, we strongly encourage no alcohol use for 12 to 24 months at all.
Dr. Jessica Hamilton is a clinical psychologist who evaluates patients before weight loss surgery. While she doesn't specifically talk to patients about transfer addiction, she does talk to them about the risk of alcohol use disorder.
There are correlations and there is some evidence to talk about the risk of alcohol use increasing after surgery.
That was true for patients like Anna.
Did you have a problem with alcohol before this?
No, I was always the designated driver for my friends.
And Marianne.
Everywhere I go, I meet people who've had weight loss surgery and are alcoholics.
The two are part of a Facebook group called Transfer Addiction After Weight Loss Surgery, which has nearly 13,000 members. Anna joined after her surgery in 2020 when she developed an addiction to alcohol, got sober, and relapsed. Marianne, who did struggle with alcohol before her surgery, said her addiction got worse after she had her procedure in 1979.
What do you think about them saying there's not enough research and data on this issue to say it's actually an issue?
Hogwash. That's what I say, hogwash. I went through years and years of going to physicians and going to psychiatrists and going to therapists for help.
Was this the last trip you took?
Amanda says she tried desperately to get her sister help.
How many times did she go to rehab?
1, 2, 4.
Carrie was about to go back to rehab for a 5th time when she was found unresponsive on her kitchen floor. She died in November of 2018. The cause of death, alcohol poisoning.
What do you think when you hear that it's not mandatory for doctors or surgeons to tell people about the possibility of transfer addiction?
I would tell them they can have my grief, and they can have my pain, and they can have my anger.
Amanda hopes this story leads to a conversation about including transfer addiction in pre-surgery education programs.
The Metabolic and Bariatric Surgery Accreditation and Quality Improvement Program updates its standard of care practices every couple of years based on feedback from those in its accredited programs.